I think we are live. So how many times I say this? A lot. So
you're an expert on it now.
good evening again. Well, I say again because I was live like 5 minutes ago. So this is American Surgery Center Bariatric Program. My name is Kemal Erkan, and today is June 11th, our Bariatric Friday event. I'm here with Dr. Isaias Irgau. We are going to discuss a couple of the issues related to bariatric surgery. Today is going to be more on the pandemic, COVID-19 pandemic, and the effects of the COVID-19 on the weight gain and the difficulties. And I'm going to ask Dr. Erkan to introduce himself, and then we'll start our session.
Hello, everybody. Welcome to Bariatric Friday. My name is Dr. Irgau. I'm the president of CHRIAS, Christiana Institute of Advanced Surgery. My specialty is weight loss surgery or bariatric surgery, and I have been performing bariatric surgery now for almost 20 years. And alongside with my associates at CHRIAS, we're actually the most experienced group when it comes to bariatric surgery in our area. We've established centers of excellence for bariatric surgery in many of the area's main health systems, and more recently at the American Surgery Center, which is a freestanding ambulatory surgery center, one of the very few in the United States to be accredited as a center of excellence for bariatric surgery. I'm very happy to be here again, Kemal. Thank you.
Thank you, Dr. Irgau. So let me start our slideshow. So apparently today is our completion of our second cycle for these events. So we did 18 events last year, and then today is the second set of the 18. So 36 events in the last several months. And we are extremely happy that we are able to do this. Yep. So we are trying to come up with different topics. Some of the topics have to be repeated, so which is fine, because we need to hear more and more several times in order to understand or maybe register some of these issues. So it's definitely okay to hear these issues. Our goal is to help patients with morbid obesity, and then because of this, we have a team of providers, caregivers in our program, and I do want to introduce our surgeons so that everyone is aware of who we have, and Dr. Irgau, everyone knows him. Dr. Gail Wynn, one of the most experienced female surgeon in bariatric in United States, maybe even in the world. So she is also our co-founder. Dr. Mike Peters, Dr. Rahul Singh, and Dr. George Ibrahim. And also we do have a colorectal surgeon in our program, and in some cases there are some patients we may be able to work together with the colorectal surgeon, but mainly it's not they're independent from the surgical side. It's an independent side of our business. So as many of you know, we have our nutritionists, dietitians, Fran, Amy, and Beth. They work with our patients throughout their process. Yep. For some patients, at a minimum 3 nutrition sessions that they do. In Medicaid group, that's 6. Medicaid, unfortunately, is a little bit, I call their request or their requirement a little bit vindictive. They want 6 consecutive months, which is not right, because it's almost like trying to put the apple a little bit farther away, and then you want to reach. So I think that's what they are doing, and I'm hoping that maybe we can change this issue with the Medicaid managed cares in Delaware, at least. Now, I say this because one of the things that we need to mention, Dr. Irgau is also the president of our our FASMBS local chapter. And in fact, we had our first meeting last night with not just with our group, but with all the bariatricians, bariatric surgeons, anyone who is involved in the bariatric care in the state of Delaware. So Dr. Irgau, if you would like to say anything related to ASMBS chapter.
Absolutely. Thank you, Kemal. So the ASMBS is the National Organization of Bariatric Surgeons, the American Society of Metabolic and Bariatric Surgery, which is an organization that has been in place for decades now. In addition, there are chapters in each state to really promote the cause of the treatment of morbid obesity in the specific settings where different communities live. So each state has their own chapter, and we in Delaware have our own chapter, and I was privileged to become its president this year. And what do we do? Essentially, what we do is what we do in our practice. We want to promote in our community awareness about the dangers of morbid obesity. We want to raise the awareness about the availability of effective treatments for morbid obesity in the form of surgical treatment, which has been refined to highest levels of safety currently. So this is what we would do. But the other thing that we would do also is advocate on behalf of our patients when there are barriers to access to bariatric surgery. As you mentioned, Kemal, sometimes there are unreasonable barriers that are placed in front of patients when all they need is access to treatment, right? And if there are biases in terms of looking at obesity differently from any other diseases, then it's very easy for insurance companies to get away by putting barriers, like asking for really unnecessary lengthening of the preparation process, which we have fought in the past successfully. There were times in which insurance companies used to require mandatory weight loss before being eligible for bariatric surgery. And we've successfully demonstrated that that was not really medically necessary. And many of them have since rescinded that. And now we actually know, Kemal and you and I have come across this, that there are some companies, some employers that have self-funded health plans that actually actively preclude or do not include bariatric surgery as a benefit, so that a patient seeking for treatment, they will find out that their insurance actually will not cover bariatric surgery. This is really totally unacceptable in this day and age. And as a chapter of ASMBS that really groups all the healthcare providers that are really active in bariatric surgery, we can be advocates for our patients in Delaware, approaching the companies that are really stationed in Delaware when there are problems like this, which are clearly barriers to treatment and to care. I can't hear you, Kemal. Sorry.
So, you know, because of Buddy, I have to sometimes mute, and I normally don't like muting, but I'm not used to unmuting because I never mute. So if you recall this article that I wrote, I think was, I don't remember the date anymore, but maybe 2 years.
Yes, about 2 years ago, I remember.
We discussed some of these issues, and obviously you were the big part of this article, because whatever I learned from bariatric is from you, but understanding the issues from the business side of it, the insurance side of it, and how difficult for our patients to go through different parts of bariatric process, and why we have to put a system in place to make this extremely seamless and effortless. But it's really taking a lot of people doing so many things at the same time to get to this. And we are actually working with, we are going to put more pressure on the insurance companies, especially Medicaid, to not to have this 6 consecutive months. So, you know, Dr. You see like the problem of being vindictive, right? So like 6 consecutive months, like if you miss one, you disqualify for why do we treat this like a reward? Like you have to deserve it.
Absolutely.
Well,
Absolutely.
you don't get metformin when you have, A1C at 10. They don't tell you that, well, you first need to reduce your A1C to 8.5 and then we'll give you. Like, they don't do that, right? Why is this ridiculousness is happening in bariatric? And because, we are also the local chapter, I think we have some responsibilities, and we do really need to standardize this. And you and I, we know that, and you know how sensitive I am when it comes to the medical policy. And unlike many other business people in healthcare, I am more strict than the providers. And you called me out a couple of times when, not called me out, but you said, well, Kemal, we always have the opposite problem. Business people are telling us doing this differently, and you are always the opposite, and I will be. But when it gets to 6 months nutrition, and like it's almost like someone is just waiting, like you have to do 6 months, otherwise you don't get this. Like,
absolutely.
So what do you think about that?
Well, I mean, that's the whole issue, right? If you don't see obesity as a disease, and if you can get away with that because there is a bias in the society where discrimination against obesity is acceptable, right? In the open, right? You don't even hide it. You just show it openly that it's okay to discriminate people when it comes to obesity, right? Then they can put all sorts of barriers to care, and they can get away with that. And that's why we have to be proactive in this setting and challenge them on that, Kemal, right? For a patient to seek treatment for a disease, they should not have to have a rite of passage. In other words, we don't say to them, well, you have to climb this type of hoops for you to be able to earn this treatment, right? That's ethically unacceptable. We are here to provide care, right? And when we see the need, we provide it simply and straightforwardly. When we say to patients, oh, you have morbid obesity. Okay, well, and we're okay. We can authorize bariatric surgery, but first you have to go through these strict 6 months of consecutive appointments where you have to show us that you have attended those nutrition classes. Well, to some extent, we have told the insurance companies that bariatric surgery is best done when there is adequate preparation of the patients, right? We're talking about education, which is geared to make bariatric surgery successful. So we educate the patient, we evaluate them, we optimize their overall health so that they are safely, they go safely through the surgery. That's what we do. But we don't tell them, if you miss this appointment, then you have to repeat everything else. What is the purpose of that? If not, as you say, to try to create barriers to people who are going through this, right? And then what is the purpose of having 6 consecutive months if shorter, encounters will be sufficient, right? You will see a lot of people look at this as something that they cannot overcome because they are busy, because they have a life, because they have to earn their living. And guess what? Then they abandon their plans for bariatric surgery. And what happens 2 years later? They are much worse. Their health is worse. Their weight is higher. They've suffered more. They have more comorbidities, right? And all this delay because we have placed unnecessary barriers when they seek care. It is hard enough for us to really convince people that treatment is available and that surgery is safe. And then if on top of that, you're going to put these barriers, of course, you're going to have less and less people looking for that treatment. And that's a tragedy.
So, Dr. Irgau, the issue that I see, like today, we are kind of just on a freestyle. But I think as I was listening to you, one of the issues that I see, and I use this a lot because, there are different ways of saying this. Common practice is not common sense is not common practice.
Yeah.
Like the oxymoron. When I say that some people are looking at like, why am I, using that? Because there's no good way to explain the situation. Now, I'm going to give you an example. So I just want to make sure that everyone understands what we are discussing here. So the problem that we have is the method of treatment or our philosophy of treatment from the insurance company standpoint is there's always, again, vindictive, but almost like penalizing. So you have to be penalized almost, or you have to be in a severe situation. But then the part that they don't understand is you get to that severe situation because you don't take care of the problem earlier. Now, we had with our dietitian, Amy, we had a guest last Wednesday night, Celeste. She was showing us the continuous glucose monitoring devices.
Yep.
As she's explaining, and my from the clinical side, once I understand, there's no issue, but I can also add other stuff together with different specialties that we have 24 of them. So, and she said, in order for this to, like, patients to qualify for this, they have to really demonstrate that they are not able to manage. But by that time, they're already, the disease is already out of control.
Absolutely. Absolutely.
You see what I mean? Like, this is so like the oxymoron. Like,
yep.
Why don't we give you that earlier? Now, why am I even telling you this now is, if you remember earlier in the case conference, we had a patient BMI is 39.7.
Yeah.
What happens if you don't have sleep apnea, if you don't have diabetes, if you don't have hypertension, and if you don't have heart disease, you are not qualified. Like, the word qualified for surgery, unless you are using it from the clinical guidelines, is one thing, but they are not. Like, so you have to go home and gain weight and get to over 40. Is that what we are telling our patients, like the insurance companies? Like, you see how that's kind of like putting them in a different direction and getting the continuous glucose monitoring. I have to really be a bad patient and non-compliant to deserve the machine. Well, give it to me early on, so then I don't have to be dealing with that problem, right?
Absolutely.
Now, today, I also want to kind of discuss the pandemic, and still, like, although we got our vaccine, and I think now we are at 52% of the Americans, they got at least one.
Yep, that's great.
And then the state of Delaware is doing very well. I had just recently I met with Governor Carney, and he is committed to make this even better, and that's my understanding.
That's great
from him, and which is really good. But patients are still struggling. So many patients, they gain weight during this time. Many prospect patients, many patients who were going through the process. So what would be the best way that we can actually manage it during these times? Even if it's slowing down, there are different things that patients can do. If you can just give us some education.
Absolutely, absolutely. So as you correctly said, Kemal, I would not be surprised if the nation's average body mass index has gone up by some units just because of the pandemic, right? The pandemic was almost like the perfect storm in terms of really getting people to gain weight. We are isolated, we are stressed, we have hoarded a lot of food, thinking that maybe food was not going to be available. We have more time to cook. We have more time to watch channels about food. And also the food is readily available to us, right? We're not going out, we're not going to work. And more importantly, also the opportunity for us to be physically active was limited because of the isolation as well, right? All that combined really led to a lot of people really even unconsciously to eat way more calories than they usually do and be less active than what they usually do. And that setup really leads to us gaining weight, because we have a body that preferentially wants us to gain weight when the opportunity arises, right? It is very hard for us to lose weight when the opportunity arises, but it's very easy for us to gain weight when the opportunity arises, right? That's really the key problem that we have. That's why we struggle with obesity. And it was demonstrated during the pandemic perfectly, because I saw it in my family, I saw it in my friends, I saw it in my patients. It was pervasive. So, and as we go forward, Kemal, what the advice I give to our patients is really to be conscious of this. Sometimes just being conscious of it is helpful, but it's difficult to be conscious every day. So you have to have some type of system that helps you with this. And you and I have talked about that. So what I very often talk about, Kemal, is to adopt what is called a time-restricted eating habit, which means that you schedule a certain window during the day, during that 24 hours, which you say to yourself, this is going to be the time for me to consume food, to consume calories, whether it's drinking calories, whether it's eating calories. You say to yourself, between this hour and this hour will be my eating window. Outside of that window, I will not be eating. I will just be having water or a water substitute. Now, that window can be narrow or large depending on your tolerance level, right? There is no set rule. But at least if you put that, it means that you're not going to be snacking mindlessly. And that's what hurts people most of the time, right? You are in your office working on the computer, suddenly you have to go to the bathroom. You get up, and if the kitchen is on the way to go there, Kemal, you are going to munch on something without any issues, right? Because when we see food, that's what we do. Now, if you have this time-restricted eating schedule in your own schedule, say, okay, it's not time for me to eat, you will go to the bathroom, come back, and the chance for you to eat are going to be much less. So that's one important thing to adapt.
Now, you do the intermittent diet right now.
Yes, absolutely.
And
absolutely.
I'm doing a modified one. We are doing the same intermittent diet, but we are doing it in different ways. So
yes.
Now for me, it's Monday through Friday.
Yep.
And after 10 p.m., I may be lying a little bit. 10 p.m., I don't eat until like 7 p.m. Now, last couple of days, because I know that Anne and Anna are watching, that they're going to just call me out. So I got hungry here around like 5-ish. And then I was in the office, and it was already several hours, so I didn't have a problem. So I don't eat between 10 p.m. and 7 a.m. Like today, so it's almost 1:30. I got up around 6:45, 7, and have coffee, water, and other stuff I didn't eat. So now you do it differently.
Yes. So I do it differently. I include weekends as well. So what you and I do is a little bit more difficult for most people, Kemal. It's what they call a warrior schedule, because we really spend several hours without eating. And to some extent, we got accustomed to it and we support each other on it. So we're able to really stick to it a lot longer. It may be hard for most people to adapt to this fully, but what they could do, Kemal, as I said, is to have windows in which they say to themselves, in this 24 hours, right, there will be a window in which I will allow myself to eat. That window could be from 10 a.m. until 5 p.m. It could be from 11 a.m. until 8 p.m. Or depending on when it is that they struggle most, they could allow themselves to eat during the period in which they struggle most and then not eat during the others. Really, the idea is for them to adapt this avoidance of mindless snacking, which is what gets a lot of people come out in our society, because the presence of food is so pervasive, right? Every table that we work on, every room that we walk through has some kind of snack, some kind of food. And we want to avoid that mindless increase in calories because they accumulate. It takes an extra 100 calories a day in 1 year for a person to gain 10 pounds in a year, Kemal, right? And then if they do that for 5 years, that's a big number, right? And that is just 100 extra calorie a day, right? Now, if you did the reverse, if you stopped eating 100 calories less a day, you wouldn't lose that much weight, because as I said, our body is much happier to gain weight than it is to lose weight. And that's our problem, right? So what we're saying is, yes, I mean, yeah, absolutely. It's called intermittent fasting, but intermittent fasting may be too much for most people, right? So what I talk to them about is about restricting the time in which they allow themselves to eat, right? Say, for instance, it could be even daytime. They could say after breakfast from 8 a.m. or 9 a.m. until 3 p.m., I will not allow myself to eat. I'll just have water. Well, they've taken a good chunk of the day out in which they could have been snacking, Kemal. So that, I think, helps greatly during the pandemic from that sense. And then the other thing that obviously is important is to move, right? Movement is important.
Before we go to the move, because I'm
Yeah.
sharing this one, I just don't want people to worry about, if you do intermittent diet, you don't have to look this bad. Don't worry about the look. So that's his style. It's not diet. So it looks kind of scary there. So
absolutely.
Now, I know you're proud of me with my changes with what I did with the move, and I was just checking the average walk, average step that I do. Right now, I'm the weekly average last week was 8,700. So
that's great. That's great. That's fantastic.
And
that's about almost 6 miles, right, Kemal?
No, it's 4.2 miles. It says average.
Okay. So that's a lot. That's a lot.
And it does require for me to kind of plan and just motivate myself. But what I realized is that I'm like, oh my God, how much was I sitting? Like, if I wasn't doing those, so I'm putting different, different goals so that I can actually do this. I do some part of it in the morning and then some in the evening. And slowly it does show the impact. And I know that you have made comments before, and this is really an easy and least costly, zero cost actually. Exactly. So only if you go to Starbucks that may cause you anxiety, but it takes longer to get Starbucks coffee than getting a colonoscopy at surgery center.
I know.
21 minutes, twice in a row. So, but it's about 1.2 miles from here. So even if I'm not going to do that, I just put that as a goal and I walk there and then come back. That's 2.5 miles. So,
absolutely.
And then I know you also walk a lot.
I do. So what happened was, obviously, with the pandemic, one of the things that happened is we had less access to the gym, to exercise places. So you have to find an alternative, okay? And what very often, Kemal, is people underestimate how important walking is as a form of exercise. In fact, if you're able to walk about 20 to 30 minutes a day on a regular basis, that brings about humongous changes in your metabolism, in your metabolic health, reduction of high blood pressure, reduction of blood sugar, overall important improvements in health, but also help to keep the weight down. So what we're talking about here really with the pandemic, Kemal, is not necessarily just weight loss. We're saying avoid weight gain, right? Because that's what happened during the pandemic. And one way to do that is to be active. And the activity, as you correctly said, Kemal, we have the tools now. How about looking at your phone? How about looking at a gadget that you may have that actually can track how active you are? And you can see there how many steps are you walking a day. If you're able to walk 5,000 steps plus every single day, that's fantastic. And it doesn't have to be purposeful walking. It could be walking that happens as you do your daily chores. Now, as you become aware of that, Kemal, you will also do other things. For instance, if you go to the store, now you're not going to look at the closest place for you to park like we always did in the past. You're going to go to the furthest because that will add to your daily steps. So that kind of conscious activity of your mind day after day no question will help greatly. And these are simple things I talk to my patients as well, Kemal.
Absolutely. So now, Dr. Irgau, we'll have different topics coming up later on. I actually sent request letters to our patients who have done the surgery. So one of our goals is to bring some of our patients to these sessions.
Absolutely.
And if they're watching it and if they already received the letter request, if they can please contact us. We want to have discussions with them, and if they would, we want them to share their experience with other people. Now, struggling with weight is extremely stressful. Mm-hmm. Most people are going through the depression type of issues. Most people are sad, upset when you wear something, it doesn't fit the way it used to, and just even from without having the morbid obesity, the little changes that we see in our own life, it's extremely rewarding. And then when, like usually what I say to myself, I'm like, if I feel this way, imagine the patient with the BMI 48 going down to BMI 35 in 8 months. Yep. That patient, this is like an extremely rewarding change for them, and how much they can be motivated in life. And, you know, again, going to the root of the problem, it's obesity that's causing others. It's not like others are causing obesity. Yep. So yep. If we are to address the issue at the root, then I think we are going to be able to have a better outcome. Now, Dr. Guys, you know, we have our events on a set schedule now, but I just want to go through those. So our Bariatric Friday is on Friday at 1 p.m. We do have our webinars, seminars, second and fourth Tuesday, 6 p.m.
Yep.
And then there is a generic update from me on Fridays right before the Bariatric Friday event at 12 noon. And Wednesday wellness webinar, second and fourth Wednesday, 7 p.m. And I have to tell you, this is, you know, Dr. Irgau, one of the things that I do. I participate in those mostly, but I have to manage. I have to drive the mouse and the keyboard, and that requires me to pay full attention to the topic. And it's amazing how much I learn. I'm like, I thought I knew this already, and then it turns out that I didn't. Absolutely. And even some of the technical stuff that makes even more sense, you know, how we discussed the A1C not being a perfect score for the patient, but then you have the proctosamine, but then that's also not perfect because we want to know if the patients are in the range of the normal range, and there are different ways to capture that is really important. And I think most patients would benefit from these. And of course, you can find all these on our YouTube channels, and we'll be back with more sessions in the near future, well, next Friday. But we want to make sure that we can interact with some of our patients, and that's what we are looking for, hopefully. Anything you would like to add before we close, Dr. Irgau?
No, precisely what you just said, Kemal. I think the learning process never ends, particularly when it comes to our health, when it comes to the struggles we have with weight. These sessions provide a lot of information. Even just the exchanges that you and I have, we ourselves learn a lot. So I would encourage our patients, as I do to my patients, to continue watching these sessions, actively participate. And then if some of you are okay to come out and discuss these issues in the open, you will just help greatly other patients as well who may be thinking about this. So I agree with you on that, Kemal.
All right. Well, thank you so much, and thank you for being with us today. And we'll see you next week then.